I will now be addressing an important aspect of diabetes which is generally not spoken about these days. This is about an elderly patient with diabetes. Why is this important? Because the people in this age group, when compared to people without diabetes, are known to spend more time in the hospital either as an inpatient or their visit to the primary healthcare physician is more common, and usually their problems other than diabetes are also equally more common. Who would be qualified as elderly? I am sure that most of you would assume that anyone above the age of 60 is called an elderly. However, Popplewell and his workers have defined elderly as anybody between the age of 65 to 75 and above 75. The former are called the young elderly patients, and those above 75 are called the old elderly patients. There are not many significant trials involving this special age group around the world. However, there have been two major organizations such as the European Diabetes Working Party as well as the Veterans Association Department of Defense, which have laid down different guidelines to help the primary care physicians and healthcare professionals around the world. This slide would actually show some of the curses in today's way of living, but these are not things which would interest the elderly population a bit. What are the goals that one would aim for? If you were to notice very carefully, there are no standard goals. A level between 7 to 8.5 millimoles of blood glucose is more than enough for an elderly population. This generally would be depending upon the incidence of retinopathy, which is the diabetes affecting the eye, or if you have got a kidney affection, or if you have had a heart attack in the past. The blood pressure levels, however, are to be kept at a level equal to or below 140 upon 80 millimeters of mercury. The cholesterol levels would be just as low as for a normal person belonging to a younger age group. Why are the elderly people to be carefully monitored? Because they are forgetful. There have been instances when people have taken their dose of medicine and they are not sure whether they had their food. Probably they might even overdose themselves a second time, having totally forgotten that they had already dosed themselves. Most of the elderly people might be staying without their family members. They might be in an old age home or in a care dependent home. So if they are not keeping a proper medicine log, they might sometimes cause more damage than benefit. The low sugar levels are more dangerous than in a younger adult because the response by the body to low sugar levels is very, very slow as age catches up. The complications related to diabetes are more common in an elderly population. Normally, a person, when they are told they have low sugar, the first thing which comes to mind is tremors and sweating, which are the frequently seen association with low sugar. However, being an elderly patient, these are not the symptoms that one would normally see. Instead, one would be seeing confusion, one would be seeing drowsiness, or even a sort of different mentation called delirium. So these can be frequently mistaken for a transient ischemic attack, a stroke or a paralysis, an epileptic fit, and even a confusional state. So it's very important to be aware that an elderly patient can have low sugar and still not have tremors or sweating, which are generally seen associated with low sugar levels. As with any other population group, it's very important to have frequent checkups with the healthcare professional. So they should have a regular comprehensive check and laboratory tests to make sure that their metabolic control is excellent. It's very important to have at least an annual eye checkup. a kidney checkup and a feet checkup. However, if there are complications related to these three, one would have to resort to more frequent checkups. The feet are one area where generally the diabetic people rarely are concerned about. However, as age catches up, it's more important to have a look down at the feet, either with the help of a mirror or with the help of a worker or a person with whom one is staying. It's very important to maintain the normal level of mentation, because good eyesight, good hearing, your level of education and your capacity to know more about diabetes would help you in managing diabetes better. There are places around the world which even do a mini state level examination, which would help in determining the amount of cognition that one has. Now, nutrition is of equal importance in the management of diabetes. Generally, as age advances, the digestion becomes slower, the ability to take in more food becomes less. So, people would tend to compromise on many of the well-known vitamins and minerals which are essential to maintain a balance in life. It's equally important not to lose too much weight or not to gain too much weight. But of equal importance, as with other people, you should stress on at least half an hour of moderate physical activity given the limitations. If a person has got poor eyesight or has got low back pain or knee pain, one would not expect to do something very aggressive. However, hydrotherapy, where you do exercises in a swimming pool or in a water tub, are well known exercising methods which would be comfortable and safe to the joints in the elderly. It would be equally important to avoid smoking and also to be aware of some of the medicines which are safe for use in an elderly population. It would be equally important also to be concentrating on your cholesterol levels as well as the blood pressure levels. Metformin, one of the cornerstones in the management of diabetes, can be used provided there is no gastric upset or there is no failing kidney function. Sulfonylureas, another medicine which is generally used in the management of diabetes, is generally used in reduced doses or avoided because it can cause low sugar levels for most of these people. There are other groups of medicines called thiazolidines which are avoided because it can cause fluid retention and can also damage their already brittle bones. DPP-4 inhibitors, which comes as a class of incretin therapy, can be used safely provided the kidneys are functioning properly. Complex insulin regimens are better avoided because most of the people would forget at this age on which dose to give at what time, and frequent mishaps can occur. To conclude, an elderly patient with diabetes should have a good glycemic control, what is acceptable for their age, and also with the concurrence of the attendants and the patient. They should have some access to healthcare professionals whereby they can try and visit them more frequently, and the elderly population group should be encouraged to take active part in the discussion and also help them log their blood sugar levels, their food diary, as well as their time of medicines to help manage diabetes in a better way. Thank you very much.